We'll want to pause that to go through the instructions.
Oh, thank you. Thank you so much. Can we get interpretation going, please? And once again, we are going to be offering a simultaneous interpretation into Vietnamese and Spanish and English. And for those of you who need the service, we're still trying to, we're just gonna enable it quickly. There, thank you. So those of you who need the service, if you are joining us from your computer, please look at the bottom of your screen. You're going to see a globe that says interpretation. Just click on it and you will be able to select your language of preference. Next slide, please. If you're joining us from a cell phone or a tablet, look for the three dots that say more. Click language interpretation, select your language, and then make sure you click done or so it takes. I'm going to ask my colleague Vic to go briefly into the English channel. Those of you there should be able to hear him. If you do not, please let us know. Thank you. And now I'm going to give instructions in Spanish. Buenas tardes. Vamos a estar ofreciendo interpretación al español, vietnamita y al inglés. Para las personas que necesiten este servicio, por favor, si nos están acompañando desde su computadora, vean la parte de abajo de su pantalla de Zoom, van a ver un icono de un globo que dice interpretación, hacen clic ahí y eligen su idioma de preferencia. Next slide, please. Si nos acompañan desde un celular o una tableta, busquen los tres puntos que dicen más. Ahí van a tener acceso al menú donde se incluye interpretación de idiomas. Si hacen clic en interpretación de idiomas, pueden seleccionar su idioma de preferencia y luego hay que hacer clic en listo o done para que funcione. Le voy a pedir a mi colega Vic que por favor vaya brevemente al canal de español. Los que están ahí deben escucharlo. Si no lo escuchan, por favor díganos en el chat. Muy bien. I will
các bạn
start.
biết rằng là cái hội nghị này được hỗ trợ bằng tiếng Việt, cho nên vì mà nếu ở máy vi tính thì làm 3 bước. Bước 1 là bên góc phải ở trên bấm vào quả địa cầu. Bước thứ 2 bạn chọn ngôn ngữ tiếng Việt bạn muốn, và bước thứ 3 bấm vào chữ Vietnamese ở bên góc phải cuối cùng. Vậy là xong. Nếu quý vị mới dùng điện thoại di động cũng là 3 bước. Bước 1 bấm vào chữ More ở 3 chấm ở phía trên. Bước thứ 2 bấm vào ngôn ngữ phiên dịch, ở đây là tiếng Việt, và thứ 3 bấm vào chữ Done. Thế là xong.
Thank you again to our interpretation team. This is the 6th session that they will be interpreting for us, and we just want to extend our gratitude to all 4 of them for helping us make this event happen. In addition to that, we have been on a journey, my friends. We are in our 6th and final session of the Texas State of Enrollment Conference. Thank you so much for being here with us all today. As a reminder, all recordings, materials, and resources will be shared with each of you post-conference. As you entered this space, you probably noticed that it looked very different. That is because we are in a Zoom meeting. We have left the webinar space and now we are in a meeting where everyone can have their video on. Everyone's mics can be muted and unmuted. And that is because we wanted to create a space where folks could really come together and connect for our last session. This is my plug to our friends who are in the Zoom lobby. If you would like to get the most you possibly can out of our final session, I strongly encourage you to join us in this Zoom meeting space. You will still be able to watch a breakout room from the lobby, but if you want to be really immersed in community with your colleagues and peers on today's call, again, I recommend that you join us in the Zoom meeting. Thank you so much. We have some lovely facilitators who are joining us on today's call. Many of them you have seen, many of them have been behind the scenes throughout the course of the TSOE conference. Hi, you've seen me, but my name is Katie Martin Lightfoot. I am the Director of Strategic Campaigns and Engagement at Every Texan. My colleague and partner in crime is Simona Harry. She is our Deputy Director of Strategic Campaigns and Engagement at Every Texan. We're also joined by Sara Cincos. She is the Policy and Research Coordinator at Young Invincibles. And we have Amber Ayala, who is our Storytelling Coordinator at the Children's Defense Fund of Texas. And last but not least, you all know her. We have Lynn Coles, who is our Director of Health and Food Justice at Every Texan. Very grateful to have all of these lovely ladies who will be my co-facilitators for today's session. For our learning objectives, we just wanted to put these in front of you. I am going to read them aloud so our interpreters can interpret them. Participants will identify and connect with peers in their regions to build relationships and strengthen local support networks among enrollment assisters. 2, participants will exchange practical strategies, resources, and solutions by sharing experiences, challenges, and ideas in facilitated roundtable discussions. And last but not least, we hope that you will foster a sense of community and shared purpose that supports ongoing collaboration beyond the conference. And with that, I wanted to share that we will be opening up breakout rooms by region. And I want to explain this slide and the rooms to you all at this time, and we'll come back to this slide as well in just a minute. But we realize that these regions might not be the most accurate for our big state, but we want you to select a room that best aligns with your location. So in this main room, there's going to be a group of us from Central Texas that stay in this main room and we don't go to a breakout room. In addition, we are also going to ask any of our friends who are in the Spanish language channel or in the Vietnamese language channel to stay in this main room. That allows our interpreters easy access to continue doing that simultaneous interpretation. So again, in our main room will be my friends from Central Texas, as well as anyone who is utilizing interpretation needs. In our first breakout room is going to be with Simona. She has been the one in the chat box answering your questions and dropping links. In room 1 will be our friends from the RGV, the Rio Grande Valley, as well as our friends from South Texas. Again, whatever room makes the most sense for you, go to that space. Room 2 will be with Sara. She will have folks from West Texas as well as the Panhandle. Room 3 will be with Amber. She'll have folks from the Gulf Coast, so think Houston, Harris County, as well as East Texas. And last but not least, we will have Lynn in breakout room 4 for North Texas. When the breakout rooms open, it will say RGV South Texas, West Texas, North Texas. And so we're hoping it will be easy for you to select the breakout room that best aligns with your location. And a reminder, if you are needing interpretation services or you live or serve folks in the Central Texas area, please make sure that you are staying in this main room. When we enter our rooms, our fabulous facilitators will move us through these 3 conversation questions. Please know that we are going to ask these questions, but wherever our conversation takes us, we want to make sure that your time with your peers and colleagues is meaningful for you. But some conversation starters are: 1, what challenges are you facing as an enrollment assister in your region? 2, what opportunities do you see to strengthen enrollment efforts and community outreach in your region? And number 3, where do you see opportunities to collaborate with others within your region and across the state? Again, this is your opportunity to share, connect, share any challenges, offer ideas, and ultimately, hopefully, form some connections that you will get to engage with today during this session, but also thinking about in the future as you are going back to your communities, as you are going back to your clients and the communities you serve, knowing that you have this strong network of folks who are all experiencing similar and, of course, different things than you are. And with that, I do want to pause to see, I'm seeing our chat box. There's some questions here. I want to pause to see if there are any questions before we officially open our breakout rooms. Not seeing any in the chat, not hearing anybody coming off mic. For our friends in the lobby, again, this is another invitation to join us in the Zoom meeting space. If you are unable to join us in the Zoom meeting room, do know that you will be able to see the conversation happening with our friends in Central Texas. And I will do my best to keep an eye on the lobby chat to see if there's anything that you would like to add into that conversation. Okay, friends, let me see my next slide. Oh, here we go. All right, I will ask if Jeff can open our breakout rooms, and I will ask each of you to again select the room that makes the most sense for you to enter. At this time, I believe that all rooms are now officially open. Simona is going to drop instructions in the chat about how to enter a breakout room. But if you, hopefully if you're looking at the breakout room, you're able to either select RGV South Texas, West Texas or the Panhandle, Gulf Coast or East Texas, North Texas, or if you're in Central Texas, staying in this room. And we'll give it a few minutes for folks to move to your rooms. Paula, good question. In terms of San Antonio being South or Central Texas, I will let you decide. Because yeah, that does fall in both. Maybe also see who's joining those rooms to see which one makes the most sense. Yeah, Sonia's like, it can go either way. And I'm going to stop sharing my screen as folks join their breakout rooms. And if you are in this main room with me, that means you either live or serve in Central Texas, or you need interpretation services in either Vietnamese or in Spanish. If you are if you are in a different region, as a reminder, our breakout rooms are open and you can join our friends in the Valley / South Texas, West Texas or the Panhandle, Gulf Coast or East Texas, or North Texas.
I didn't get that Zoom, that breakout pop-up? Where do I can't see it on from the instructions.
Let me see. If you click on the little ... more, I'm hoping this works. There should be a little box with like an X on it, like looks like a window. And if you click on breakout rooms, you should be able to see our different breakout rooms and join. I can also be kind of crazy, and if anyone needs help, if you'll raise your hand and I will pop you into your right rooms.
I got it.
Gracie,
So Houston, did y'all assign a breakout room or I just choose one?
you just choose one.
Okay. Thank you.
Of course. And if anyone needs me to put them into a breakout room, if you'll just raise your hand and say where you want to go, and I can put you in there. Looks like folks are still finding their way. Denise, what room would you like to go to?
Room 4, North Texas.
Okay. Come on. North Texas. Okay. Anyone else in the space that needs to be moved to a room? Laura, I see your name. Sorry, I'm seeing. If y'all would raise your hands, that will help me a little bit to be able to see. Juanita, sending you to Jeff. Are you in this main space? If you are, can
I
you
am.
help me?
I'm
Can
in-
you help me move people to their rooms?
Letitia, where would you like to go?
And they're in the Cecilia got there. Sarah moving to Gulf Coast. And bear with us, friends, we're moving you to the valley. Juanita is moving to the valley.
Denise Gomez. Room 4.
Gio sending you to North Texas.
Denise, room 4 is
Denise should, I think we were able to. Oh, I'm sorry, Denise. I'm seeing your message now that you keep getting kicked out. That
which is
so
room which one is room 4?
North Texas.
Okay, thank you.
Yeah. And just a heads up, I think there's a couple of other folks that have been getting kicked out automatically when you join the Zoom.
Sorry about that. And we can still also have this conversation in this main room together, but I apologize for that. Okay, sorry. Okay, I think I just got through everybody. Okay, and then
Ninfa, I just assigned you to South Texas. Martha.
Noelia, where can I send you? Noelia? Martha, where can I send you?
I just sent her to RGV South Texas.
Okay, perfect. Thank you. Okay.
I'm just looking at the chat if they put their
Yes, that's perfect. Okay. Jeff, I so appreciate you and moving folks to
I got you.
rooms. Friends, I apologize if you are if you are not necessarily in Central Texas, but you are in this space with us. I promise we'll have fun. And let me pull up my facilitator's guide and we can jump right in. Okay. Here we go. Okay, welcome to our Central Texas / interpretation room / our friends and in the lobby and / anyone who was unable to head to their rooms. Again, deep apologies for that. But I'm happy to have you here. We can do this. We can be in this space together. Again, my name is Katie, excited to be in community with you all. We are just going to be moving through those questions I shared on the previous slide before we join this space. But of course, we can go in any direction that makes the most sense for you all. I will be taking notes. So I will be looking at our chat. I will also be taking notes based off of what folks are sharing out loud. We are a bigger room, we are a bigger space. And so it would be lovely if in the chat box, if folks could share their names, your organization, and then something that is bringing you joy right now to just kind of give us a little bit of connection to start us off with. And I'll model. Again, my name is Katie Martin Lightfoot. I'm with Every Texan in Austin, Texas. And what's bringing me joy right now? The cooler weather is bringing me joy. So folks can use the chat box to share out, again, their names, the organization, where you're visiting us from, and then something that is bringing you joy right now. That would be lovely. And I'll also put that question into the chat. Life, family, love, God, amazing. Okay. So folks want to keep sharing. We would appreciate that. But we are going to move into our first question. And again, our breakout rooms are only as strong as our conversation is. So we encourage everyone who is able to come off mic or put their comments or thoughts into the chat box. We appreciate it. Hi, Mary from Lubbock. Happy to have you here. Hi, Laura. Okay. And our first question is, what challenges are you experiencing right now in your community, in the work that you're doing? But if you want to talk about your own personal experience, the experience of your clients, the experience of your colleagues, what are some of those challenges that you're feeling right now in the work that you're doing? And whoever wants to kick us off would much appreciate it. Any challenges? Here we go. Here's Sharon. Uncertainty from clients, not wanting to risk being targeted by ICE. Is anyone else in the room experiencing that? You can either raise your hand, respond, or react to Sharon's message in the chat. I'm seeing clients who say they were denied due to vehicle type or ownership. I'm seeing someone uplifting, again, the uncertainty from clients around ICE and concerns there. Any other challenges folks are experiencing in their work? Anything making you a bit anxious or a bit stressed thinking about the services you're providing or with the upcoming open enrollment? I'm seeing a lot of hand raises for the uncertainty for clients and in terms of fear around being targeted. Olga is uplifting the upcoming open enrollment premiums. Is that on anyone else's minds? And I'm actually getting some thoughtful comments from folks in our lobby, and I'm going to read these out loud for folks as well in our Zoom room. Oh gosh, sorry, I should have had my eye on this. So many. Okay. Oh, sorry. I'm like, cats are making us happy and family and our dogs. So Maria's is saying, any challenges she's experiencing again are the immigration politics nearing the bordering towns, patients feeling unsafe, mentioning ICE again in terms of their work in our communities. Lucy is sharing that she has patients that opt out of their insurance for the SLIDE program because the insurance is too expensive. Curious if anyone else is having that experience in their work. Another challenge that the new laws that came into effect, most members do not want to continue care due to immigration fears. Another challenge are that the programs changes in the issues, changes in the political environment, in the atmosphere. Qualifications for households taking care of adult children with disabilities who could not live alone, but household income is too high. Yes, the income is too high for individuals living with adult children. This seems to be a repeating theme here. Brenda's saying definitely the law changes and immigration fears are the main challenges that folks in her community are experiencing. Selena is saying that she's seen a lot of denials based on assets, which has been challenging for families that are kind of in a sudden crisis situation. For example, if someone is suddenly getting diagnosed. Prisma is saying, I worry a lot for my job area, funding and not being able to continue providing care. And I appreciate everyone in our Zoom lobby for adding in those challenges and concerns. And I'm coming back here to see what our friends in this space are saying. Shorter Medicaid retroactive coverage is a concern, as is the marketplace insurance uncertainty right now. So lots of challenges. I'm also seeing some themes pop out. Sonia, I do not mean to put you on the spot, but are any of these challenges that our friends are raising, do you have any thoughts or comments on what folks are sharing?
Yeah, I was going to ask about the assets test. I see that coming up a couple of times. And so I was just wondering which programs they're being denied for based on assets. I think Selena wrote something and then I saw it in another comment, just wondering if you could maybe drop in the chat or come off mute and say which programs people are being denied based on assets. I'm not seeing anybody respond. I think that is what is concerning to me. There is no asset test for the health insurance programs. So it wouldn't be the first time I've heard it though. So I'm wondering if it's a training issue with eligibility workers from the state. In my case, it's been for SNAP. Most of the times it has been related to vehicles. Okay. Great. Thank you for clarifying that. And I think I just want to say also that I think it's worth repeating. I know a lot of people are very concerned about the insurance premiums going up, but we still want to reiterate that if some of you didn't understand, because I had this question come up with some of our health centers, is that they think that all of the premium tax credits are going away. And I know that we mentioned earlier that that is not true. It is just the enhanced portion or the little bump up that was passed by Congress during the public health emergency. But I think that it's really important not to discourage anyone from applying. But to be frank, obviously, as Ariana told us yesterday, that we need to be, upfront and truthful and give that warning that, hey, it's going to go up, but the premium tax credits are still available. They're not enhanced, but they're still available. So it may not help as much, but making sure that people apply and make sure that they're not disqualifying themselves without actually applying and seeing if they can afford the new premium or not. I think those are just a couple of comments that I wanted to make.
Thank you, Sonia. And just pulling out some of the themes that I'm seeing from folks in the chat boxes, of course, is the immigration and fear of enforcement in terms of clients being targeted by ICE, especially in some of our border regions and towns, the different program and policy changes, the different program shifts, the new laws, making things more difficult, the affordability and financial barriers that our patients, our clients are experiencing, just access and coverage denials, also naming workforce and funding concerns. With all of these different challenges that folks have shared out via chat on this call, how are folks approaching this in their work? Do you see any solutions here? Is there something that's working really strongly in your region or at your center that is helping with any of these challenges that folks on the call have uplifted? So looking for any solutions or advice to any of the challenges that folks were able to share with us. And I'm looking to see in our lobby chat as well as in our room here if we have any advice, thoughts, solutions. And if we don't have any advice, what resources or support can be provided? What are some materials, information that would be helpful for you to be able to navigate some of these challenges that you're experiencing?
Katie, I think just, to address people's concerns about the immigration issue, we saw this really take a nosedive during the first Trump administration. In 2017, we started seeing our applications and enrollment in Texas, really nationwide, start taking a fall because of this issue. And this is probably an issue I get asked about the most from health centers. Like, what do I tell my families that are afraid? And in the past, we were able to say with confidence, these programs do not harm someone's ability to get, citizenship, or it's going to hurt another family member's green card application. And unfortunately, we're at a point right now where even that is very hard to say with any assurance, because at the federal level, we learned that the agencies at the federal level are sharing information. We don't know what they're sharing, but we know what the motive may be behind that sharing. And so I think that for everyone here, we do the best we can to, tell our families that right now the programs are still eligible for them. Right now, the policies, that are in place are still the same that were before. But I think, especially for our health centers on the phone, we can't force people to join these programs if they don't want to. But we still should continue enrolling them in the sliding fee scale program. I know there's also concerns around the definition of a federal public benefit. And if that's going to include the health center program, we still do not have guidance. So our advice to our health centers is to continue business as usual. And of course, as soon as we find more information, you'll all be the first to know, and you and your leadership will know. But I think the only thing I can offer as advice, and hopefully not to lose faith, but is to just continue talking to your families, and seeing if they can, if you can get them to apply, great. If not, again, you have to understand that we're in very uncertain times, so it's just better to be safe. But give them that information, and then let them decide what they're going to do with it. We really can't say anything else. We can't force them, like I said. So I think that's going to continue until we get some more guidance, and just ask everyone to hang in tight and just do the best you can.
Thank you, Sonia. And I think that is so critical, is that the power that we all hold in this room is information, and being able to empower the individuals that we serve with that information, and allowing them to make a decision that makes the most sense for them and their families. And I know at times that can be hard, because we want people to be able to go to the doctor and get the help that they need, or sign up for the food benefits. But ultimately, our families, the individuals that we are serving, have to make that decision for themselves and their families, and that is okay. And we are here to provide them with as much information and resources that we can, so they can make that informed decision, that thoughtful, important decision for their families. And I'm looking to see if we have any other comments. Okay. So let's move from challenges and talk a little bit about, and I know we've named a few of these, but what opportunities are you seeing? A lot of times from challenging situations, I feel sometimes that our creativity and our innovation and thinking about things a little bit differently starts to come through. And so I'm curious if anyone sees any opportunities in their community to strengthen enrollment efforts, or to strengthen outreach in the communities that you are serving. And whether you have a budget of $0 or $1 million, I think we're able to dream big here, because we have a lot of helpers on our call today. And so, are there any opportunities that you're seeing, or things that you wish you were able to do in your community or in your region?
I'd like to just also just remind our health centers, and those of you that may be contracted with CMS as a certified designated organization. Many of you know it as a CDO contract. Just want to make sure that you're aware that your health center or your organization, if you are contracted with CMS, that you can hire or train, rather, as many volunteers as necessary to help with open enrollment under your CDO ID number. So everybody that contracts with CMS has an ID number, and then you use that ID number to create a certified application counselor ID. And so I want to just remind folks that are a CDO organization that you can do that as an option, especially for some of you that have lost staff, or just need more help during open enrollment. because we don't have a lot of our federal navigator partners or as many as we did last time. And I think that really contributed to that 4 million we were able to reach. It wasn't just enhanced premium tax credits. We had a lot of boots on the ground helping us, enroll people. So I think that it's just a good reminder for all of you that if you have capacity to recruit volunteers before open enrollment, that is certainly an option to look at and should talk with your health center leadership about.
That's great advice, Sonia. Thank you for uplifting that. I'm also seeing including public charge myth flyers. I think the more resources that you are able to share with community, put up in your centers, the number of languages that we can think about. Something that my organization is able and happy to do is if we are needing flyers to be translated into other languages or any resources, we encourage you to reach out and let us know. We truly believe you all are the experts in terms of what your clients need, the folks that you support need. And so the more information that you are able to provide to us, we're hopefully able to create some accessible materials and resources and flyers and social media graphics, so you can communicate out with your community. And since I've brought it up, are there any resources? Is there any one pagers or a flyer or a social media graphic that you think would be helpful to help explain something to the folks that you're serving? Is there any potential requests that you have? Yes, thank you, Sonia, for uplifting Esther's resources from yesterday. Those were really, really wonderful. And as a reminder, all of our resources will be available post this call as well. Okay, I'm gonna move us slowly into our next question. In terms of opportunities, so I know that we have friends in Central Texas in this room, but I also know that we have friends from all over the state in our room as well. And so curious to hear, how would you like to stay connected with other enrollment assisters in your region? But also across the state of Texas. Is that helpful for you to be able to connect with folks? And if so, how would you like to connect? Is it a WhatsApp group? Is it a Facebook group? Is it an email chain? What are some ways that you would like to stay connected with others who are helping individuals and families in Texas? Any ideas? I think many of you might be on the in the Get Covered Texas coalition that meets once a month, but we'll be sure to send out that information to sign up for that coalition, because that is a pretty great place to share information as well as get information and resources as well.
Yeah, I would echo that for all of our health centers that are on this call right now to really consider signing up. A lot of times I sit in on a lot of these meetings, and every month. But sometimes I am not the one who is in front of patients and clients, helping them with their application. And I rely on you all to tell me what those issues are so that I can bring them to these kinds of meetings. And so I have been unsuccessful sometimes during my monthly calls with you all to get some of that information. So I think maybe if you guys would just come and participate in some of these monthly calls, especially the Get Covered, like that Lynn had talked about this morning and yesterday, would be a really good way for us to also kind of meet and touch base about issues. I'm trying not to put too many meetings on people's radar, but right now, with everything going on, all the changes coming, I think it's important for us to be more connected and more aware of issues as they arise. And again, I don't always hear about them because sometimes you all don't reach out to me or you tell me, but you know, I don't know if it's going on everywhere, and sometimes it is a bigger issue than we realize. So I would really strongly encourage the health centers that are on the phone or on this meeting right now to sign up for those. And I hope to see some of you, more of you join those calls. And thank you to those of you that are.
Thank you, Sonia. I'm also seeing interest in either a regional or state mail distribution list. We at Every Texan have a monthly newsletter that goes out that is affectionately called the Toad. I think it's the Texas Outreach and Enrollment Digest is the actual name for the acronym. And we'll be sure to share that link out with you all. It's been shared a few times, but we'll make sure to reshare that resource. We can also think about if it makes sense if folks are interested in doing like regional affinity groups. So obviously the assisters that work with you in your clinic or in your community, but maybe thinking about other enrollment assisters that might be in neighboring towns or cities within the region. We can think about making affinity groups there. Lucy, who's tuning in from the lobby, says that she would like to connect with others because they may come up with a way they do things that help them that she hasn't thought of yet. Totally agree. This is such a cool opportunity. There's so many of you helping Texans across the state, and there is knowledge and power in sharing out best practices. Yes. And we have just a few more minutes in this group space together, but I'm wondering if folks in our lobby, but also in the room, can share out one best practice that you kind of always go back to or you think about, or one piece of advice that you always find yourself turning to. But is there one little nugget of wisdom that we can share with our friends on today's call? And I'll keep an eye on the lobby and also in our chat here. But is there one piece of advice that you would have for your peers? And that's okay if not. And let me check here as well. Oh, Deborah says, nugget of advice, share. Encourage teammates to share what they learned and not become info hoarders. So that is such a good thing to uplift, Deborah. If there is something that is working, make sure you're sharing that piece of advice or that information with others. We definitely don't want to hoard all of that information or keep that to ourselves. You all saw Lynn's folder, and she has been helping communities for years and years now. And her brain is very much into how can I put this into the hands of other people? So yes, let's make sure if we're learning something, we're sharing something. Maria says, making sure to follow up with consumers, stay up to date with any changes that are coming out to implement. We've talked about this as well. Whenever we are having access to good, reliable, truthful information, making sure that we're sharing that out with our clients, with our consumers, in a timely fashion. So again, they are able to make that informed decision for themselves and their families. And also communicating with leadership to assist with supports and implementing change. Yes, agree. Those are awesome. Okay, I'm looking to see if we have any other little pieces of information. But if not, I think we're actually going to be closing our breakout rooms and inviting all of our peers to come back into this space. Thank you so much for joining us in this breakout room, sharing your thoughts, advice. It is much appreciated. And with that, I am going to go ahead and click close all rooms to bring us all back into this main space. Oh, perfect. Thank you, Jeff.
No sweat. You got it.
And rooms are closing. Folks will start joining us in this main space. I see our participant number going up. Welcome back, everyone, as we enter this space. Oh, hopefully. We might have actually lost people along the way, potentially. Okay, I'm seeing, there we go. I was waiting to see the participant number go up as the rooms closed.
The rooms, they're all coming back now.
Yes. My sincere apologies to our friends in our breakout rooms if we interrupted your conversations, but we did want to have the chance to bring everybody back into this main space. And yes, and if you are back, if we're all back in this main room, you might have been removed from your language channel. So if you can just make sure that you reselect your language for interpretation, whether that's English, Spanish, or Vietnamese, that would be much appreciated. And with that, for our friends that were in our breakout rooms, which was everyone on the call, if you would just take a minute to think about what inspired you from the conversation that you had. I know times are difficult right now and can be challenging, but I also know that those moments of inspiration and gratitude are equally as important. So in the chat, if you want to respond to one of these questions, either one, share something that you learned from a peer, two, share something that is giving you hope, three, share a new connection that you made, or four, share something that you learned. So again, just taking a little bit of inspiration before we conclude our conversation in about 20 minutes today, which the conference has gone by very quickly. But yes, anything that folks found inspiring, if you could just put that in the chat box. If folks want to raise their hand and come off mute, we welcome that as well.
Hi, Katie. This is Graciela Camarena with the Children's Defense Fund, Texas. I'm in the Rio Grande Valley. And in our chat room in the RGV, And although I recently had conversations with my coworker, but I am truly inspired by her heart. And I'm talking about Mary Carrion because she did mention that our work is outreach and enrollment for CHIP and Children's Medicaid. We also assist with SNAP. It's the same application. We help families. We're not funded to do ACA, but Mary does ACA all year long. She never turns away a family. She does her best to not only enroll them in a plan, but explain the benefits and all the ins and outs. And I'm also glad that she shared her relationship with other community partners like MHP Salud and Limari Ortiz, and how they've known each other over the years and have had each other's back and have helped each other. So I'm truly inspired because we think of our workload and it's a lot, and it triples or quadruples during open enrollment, but she never says no. So I just wanted to acknowledge and share my inspiration for Mary and for our friends at MHP Salud and others as well. And I just want to thank everyone for this conference. Thanks.
Thank you, Gracie. I love that. Anyone else want to come off mic and video and share something that inspired them? I'm just going to read a few comments in our chat box because I think there's some really beautiful things that are happening. I am seeing folks that are very interested in having email chains or email groups for the different regions. And I think that is something we are very happy to help set up. Jordan shared that they learned more about the process of 211 calls and the behind the scenes information. It was very helpful. Hannah was very excited to meet a new friend, Mary, who they will see very soon. Jen shared knowing that we all have similar barriers and that we are not alone. Jordan also shared that they learned about the review process coming up for HHS and how to get recipients and assisters involved. They loved that. Patricia appreciated local navigator assistance being offered by Connie with SPCAA. Rashonda really loves the dedication of everyone. It's very heartwarming. I agree. Yadira was in my group in Central Texas, but wants to say hola to all of her friends in the Valley. Amber is like, yes, let's get those chains started for our email chains to keep folks connected. I'm seeing a lot of love for some of these regional email lists, and our team, I know, is very excited to assist with that. And I'm going to pause there to see if anyone else would like to share out loud anything that inspired them, or if there's anything that they learned today before we continue on. Beautiful. Thank you for
Wait,
sharing. Oh, please.
Can I hop in? I just want to say I was inspired by everybody in the North Texas group. Also got a lot of super helpful information from Children's Health. Thank you, Denise, for contributing. Thank you, everybody from Children's Health, for taking part in that conversation. And just like learning about some of the barriers that folks are facing up there. And I will share in the chat also a link again to the survey form that people can fill out any time of the year, even though I send it out, quarterly-ish, hopefully. But you can fill out that anytime. And it's super, super helpful for me to get screenshots of when your Texas Benefits is giving you technological problems, when it's just like not advancing to the next page, when you can't get into tiers to reset a password. Those error boxes that you get where it's like the system is down or whatever, like every single one of those that I get, I send to the Health and Human Services Commission. And I'm like, hey, look, it's happening. And I'm just like a thorn in their side, which is my whole job. And so it's super helpful for me if you do like take those screenshots of those inaccurate eligibility letters, take the screenshots of the tech problems. I learned that people in Rockwall County are having problems even using Medicaid because providers aren't taking it. So we need to get to those providers' offices and make sure that they know which Medicaid plans they actually take, right? But so all of that stuff, super important. All of that stuff, please send to me using that form. Also call me literally anytime. You can email me. My email inbox is a mess. But you can send me a text message or give me a call. Or use that form. But just again, that's what these things are here for. That's what also this conference is here for, so that we can build these connections. And thank you so much, Katie, for putting this together.
Of course. Thank you, Lynn. Yes, keep those good vibes going in the chat box. Also, Lynn, if you want to drop the links to any of those resources you named, very appreciated by myself and our attendees. And with that, we just wanted to do a few more things before we wrap today's session. But I wanted to reiterate that stories matter in our work. And some of y'all got the opportunity to get to connect with Amber Ayala from CDF Texas, but we are looking for Texans to share how Medicaid has helped them or their clients. And so when we think about health access in our state, we're wanting to be able to illustrate to folks in power, to people in our community, that these programs are really helping to make sure that our communities are healthy and our communities are safe. And so we are always looking for folks to share their stories. And I know at times story collection can be difficult. That is why we have the fabulous Amber who can help you if you're trying to engage with one of your clients or a family or an individual about how to share their story and how we can use that story to have a bigger impact. So again, thinking about folks specific to Medicaid, but also any health access stories that you are able and willing to share. And how that process typically looks is that Amber has a very short, thoughtful, casual conversation with our storytelling coordinator, who is Amber. She's happy to speak with you or with your client or consumer or the community member, see if it might be a good fit. Then going through the process of just hearing their story, facilitating a conversation, and then not only having that touch point, but also helping you all share that story as well. I believe that storytelling is part of many of your work in terms of collecting those stories for funders. And this is just an opportunity to get some additional support in storytelling. But also we have a really fabulous communications team that can help package those stories for you if you're trying to get them placed in your local media, if you're trying to make something kind of pretty and branded that you want to share out as well. So if anyone is interested in storytelling opportunities, Amber's email is at the bottom of this slide, and she can also drop it in the chat. Amber, is there anything else that you would like to share out about storytelling?
Yeah, hi everyone. Thanks, Katie. I think I will just add that yes, this is not just for Medicaid, right? We're not only collecting Medicaid stories or want to hear from families on Medicaid and using Medicaid. This can be for the marketplace. This can be children, right? This can be if you had a positive or negative experience. I know we're thinking of a lot of how these upcoming changes and changes happening already to the marketplace are going to negatively affect our families. But we want to continue to also uplift those positive stories as well. And I will just say, I completely understand that families are surviving. Families are trying to make ends meet, and they may not realize they have a story or even want to talk to another person if they've had many conversations about their application status and they're just going and getting the runaround. I understand, but I also want to encourage all of us to think about why stories matter and how important they are, so that we can collectively come together and advocate for a better healthcare system that serves more families in the right way. I know it can feel very icky or very not so comfortable asking someone to share their story, but I think the more that we can in a kind and comfortable way, we can really inform others the reality that people are having to face on their own. And it shouldn't have to be this hard, and it shouldn't have to be this way. So I'll get off my soapbox, but yeah, please, I'm here to support any organization. I'm willing to partner and think through the best ways to kind of create a storytelling process with y'all. So yeah, I'd be happy to chat.
Thank you for that, Amber. And Amber will also put her contact information in the chat. In addition to stories, I think sometimes we think that it's just our clients telling our story or their stories, but your stories matter, your actions matter, your voice matters. And if I know that at least in our conversation today, folks were talking about all of the changes and how those were negatively impacting their families and the individuals that they're serving. And elected leaders are the ones who are making those decisions. And I just want to remind you all again that your voice matters, and you are experts in the what you're seeing out in the field. And if you are curious in terms of learning more about the policy making process in Texas or at the federal level, how you can advocate for your clients and community, we're here to help. And I'm going to pass the mic to Lynn to share a little bit more.
Thank you so much, Katie. Yeah, this is a good opportunity here. I think, given Amber's expertise and sharing that information about storytelling, with Katie talking about our policymakers in Texas, and the conversation that we just had in the North Texas group also about like what to do, right? Like what to do when the system is failing. And the answer is usually slow, right? There's not a button that we can click. There's not a person who we can call to say like, hey, Healthy Texas Women needs more money, right? Or we need more STI testing in this part of Texas, or we need more free vaccines for kids at this particular school, right? Like all that takes time. But we can, and this is going to sound like, it's going to sound so cheesy, but like we can only do it together, like we can only make changes that will really affect the lives, like Amber said, of people around the state and even around the country, because like the rest of the country follows Texas sometimes, I mean, like they follow our textbooks, when we make an ed policy, when we make a health policy, like other people around the country do it too. So like, and it's partly because of the size of the state, the size of the economy, but also like the richness of our community members, like the creativity in Texas. Like everybody on this call has done something amazing to help somebody access a healthcare or a food security program. And now I'm going to start crying, and I won't. I'm going to get through this. But like, so when we have moments where we know that the system creates hurdles for people or barriers for people, like we go up the chain of administration, right? So like you take the screenshots, you let me know when I need to reach out to the Access and Eligibility Services Department. And when I do that 20 times, they start listening, right? But it's only in collection. It's only collectively that we can make that kind of thing happen. And then also like, we have lawmakers in Texas who, believe it or not, have to be available to us around the year. We have lawmakers in Washington, D.C., who also, believe it or not, have to be available to us around the year. Some of them try not to be, right? And we can make their lives as difficult as we possibly can until they don't want to do their jobs anymore, and we move on to someone else, right? Or until we actually get enough people to care about the relationship between our policymakers in Austin, in the State House, right? Or in Washington, D.C. And all those people do, their whole jobs is just to like move money around, right? Like move taxpayer dollars around from one place to another. And they need our direction in order to do it well. And they don't use our direction, not all of them, right? A lot of them don't use our direction right now because of many different reasons about their funders and about their priorities, right? But like the louder we get, the more that we can convince the Health and Human Services Commission, the Centers for Medicare and Medicaid Services, and the people who run those agencies that the issues that we see every day are important, because they are, right? And the issues that we see every day are going to affect their lives. All of that comes with collective action, with collective voice. And so what we're doing at Every Texan, we're doing it tomorrow at the Healthier Texas Summit. We've done it in some constituent advocacy trainings with some of our partner groups, but like we're also working with regional coalitions around the state. Like, and I'll just give one example and then I'll stop talking. I'm so sorry, Katie. We have a group of 3 community health workers in San Angelo, Texas. One of them is a nurse, one of them is a gynecologist, and the other one I can't remember right now. But when August Pfluger, who is their representative, he's the congressional representative in Texas, in Washington, D.C., who represents that area in Texas. He came back home for a town hall during the August recess, and I just gave them all of the information. I was like, here's how many people in your area are on Medicaid. Here's how many people in your area are on the Marketplace, right? Here's the cost of Marketplace plans in the area. Like, we have all those numbers. And then they took those statements, those points to that town hall. And when August Pfluger started saying, yeah, the only people on Medicaid are like, you know, 20-year-old men playing video games. They were like, oh, absolutely not in Texas. You know, like in Texas, the only people on Medicaid are children and disabled people and pregnant people. And he had to stop in mid-meeting and, you know, prove to everybody that he didn't know what he was talking about, which that one meeting doesn't make a huge change. But then they wrote a letter to the newspaper, right? Because he was saying false statements in that town hall. And this is the slow, right? This is the collective action that we can do together to really make people listen to the issues that are important to individuals and families in Texas, to the people who really, really matter, to the people who you work with every single day. And now I will pull it together, bring it back. So yeah, constituent advocacy is so important moving forward. We don't have the same administrative levers that we've had in the past. We don't have the same connections to the federal government that we used to have. And we're really like, healthcare is the issue, right? Like whether or not people are healthy determines whether they can go to work, whether they can go to church, whether they can go to school. So healthcare is just, I said this yesterday, I think, is a really important access point to getting people to listen to us. So we're going to do a lot of this moving forward, and we're excited for your partnership, and really just want to like center you and your experiences in our collective advocacy. Thank you.
I have chills. Thank you, Lynn. I honestly can't think of a better way to wrap up this year's Texas State of Enrollment Conference. It's funny, I literally have goosebumps. But we do have a couple of minutes left, so we are going to launch our last poll of our Texas State of Enrollment 2025 conference. So hopefully that poll will launch in just a minute. And then we will also be drawing our gift card winner for our last session. From the bottom of all of our hearts here, we so appreciate you all taking a day and a half to be with us in community, to share your thoughts, your questions, your ideas. Please know that your work is so important and it matters. And Texas is really lucky to have you all on this call doing the work that you do. And so sending virtual hugs to each of you. But I am going to read out the polls so our interpreters can interpret them as well. Question number 1. I gained knowledge about other assister groups in my region. I strongly disagree, neutral, agree, strongly agree. Number 2, I learned about the challenges prominent in my region and best practices from participants. I strongly disagree, neutral, agree, strongly agree. Number 3, I plan to continue collaborating and sharing strategies with regional partners to support mutual enrollment efforts. I strongly agree, disagree, neutral, agree, strongly agree. And we thank you all for filling out the polls, for joining us for our sessions. Simona has officially done the wheel, and our winner is Christina Linderos. And so, Christina, if you are on the call, if you can give us a little hand raise or respond in the chat. Congratulations, Christina. And if you could just give us a little wave or a little comment, we would appreciate it. And with that, yes, Lynn, let's all give each other a big round of applause for joining the Texas State of Enrollment Conference 2025. I promise all slides, recordings, resources, links will be shared with each of you post-conference. Please give us a few days to compile all of those materials for you all. And we will also be sending out a post-conference survey. Your feedback is really important to us. We want to make sure that we are meeting your needs as we gather together every year. And I feel odd doing the final remarks, so I'm actually going to pass it back to Lynn to close us out.
Thanks, Katie. This has been amazing. I have learned so much from everybody in this group. We have so much work to do, and I feel prepared. I feel energized. This is going to be a weird enrollment season, and we're going to do it together. And we have we will be the catalysts for change in Texas. We will be the catalyst for change around the country. You are doing the work. And it's an honor to be here with y'all. It's an honor to be part of this conference every year. And I'm so excited for the future. In spite of the challenges, we're going to be there together, and we'll help families, we'll help families be healthy. So much gratitude to you for joining, Katie and Simona for organizing, Sonia, Amber, Monica, Connie, all of our speakers. Y'all are just fantastic, and we will make the changes that we need to make together, and we couldn't do it without you. Thank you so much. So much.
See you next year. Thanks, everyone.